Hello, my name is Nurse Pauline RN. Welcome to my channel. Today the title of my video is Hypercalcemia. Hyper means high or elevated, cal for calcium, ema means in the blood, elevated calcium in the blood. Normal calcium levels is 9 to 10.5. Hypercalcemia exceeds 10.5. We need calcium for our bones, for our teeth, strong teeth, muscles, and nerves. Hypercalcemia causes excessive oral calcium intake, excessive oral vitamin D intake. Vitamin D aids in the absorption of calcium. If vitamin D is elevated, calcium is elevated. If vitamin D is low, calcium is low. Causes for hypercalcemia: decreased calcium excretion. Example for patients with kidney disease. Decrease in calcium excretion, use of thiazide diuretics. Increase bone reabsorption of calcium, hyperparathyroidism, hyperthyroidism. Malignancies in the bones causes hypercalcemia. Immobility causes hypercalcemia. Use of glucocorticosteroids elevates calcium levels. Dehydration elevates calcium levels. People who uses lithium for treatment of bipolar, they have to have their lithium levels monitored closely. They'll do a blood draw. We are trying to assess signs of high calcium. Patients with adrenal insufficiencies need their blood monitored for elevated calcium levels. We are assessing the cardiovascular system for signs of elevated calcium. Patients will notice these patients have elevated heart rate in the early phases. Patients will have signs of bradycardia that can lead to cardiac arrest. Patients with high hypercalcemia will experience high blood pressure, bounding full peripheral pulses. Respiratory assessments will find that patients will have an ineffective respiratory movement as a result of profound skeletal muscle weakness. In our neuromuscular assessments for hypercalcemia, we notice profound muscle weakness, diminished or absent deep tendon reflexes. We notice disorientation in these patients, lethargy, coma. Patients with hypercalcemia, renal assessment, urinary output varies depending on the renal cause. In our gastrointestinal assessments, will notice decreased mortality and hypoactive bowel sounds. We notice anorexia, nausea, abdominal distension, constipation. Our laboratory findings will notice serum calcium levels exceeds 10.5. When we do our laboratory levels, this is done by a blood draw. The phlebotomist or nurse will draw blood from the patients. Interventions for patients with elevated calcium. We will discontinue any IV infusion of calcium containing. We'll discontinue any oral medications containing vitamin D. We'll discontinue any IV containing solutions of calcium. For patients' intervention, patients on thiazide diuretics may be discontinued and replaced with diuretics that enhances for excretion of calcium. Administer medications that's prescribed that inhibits calcium reabsorption from the bone, such as phosphorus, calcitonin, prostaglandin inhibitors. For patients with hypercalcemia, we'll prepare the client for dialysis if medications fail to reduce serum calcium. Patients with hypercalcemia will move these patients carefully and monitor for signs of pathological fractures. We'll monitor patients for flank pain, abdominal pain. We'll monitor these patients for urinary stones. We'll strain all stones for we will strain all urines looking for stones with patients who are diagnosed with hypercalcemia. Teaching for patients will instruct patients to avoid foods that are high in calcium. Please, YouTube is requesting, hit the like buttons. Please subscribe if you have not subscribed. Please share my videos. Thanks for watching today. Have a blessed one. Good luck on your examinations. Thank you. Have a blessed week.